Srimati Punya Salila Srivastav ji, Secretary, Department of Health and Family Welfare, DGHS, Dr. Lavnish Gopal Krishna ji, Additional Secretary Shri Vijay Nehra ji, and Director NOTTO Dr. Anil Kumar ji, and all the distinguished members of the medical fraternity who are present here today. We have representatives from the state government and one of our honorable ministers from Tamil Nadu. He's also here. I warmly acknowledge his presence. And all the volunteers, every key stakeholder, along with our friends from the media who are present on this occasion. I have immense delight in being here today, addressing you all on the occasion of the 16th Indian Organ Donation Day. It's a very emotional day for each one of us. Every year when we assemble on this occasion, it really makes us very emotional, seeing the families who've lost their members but have had the courage of donating their organs and giving life to someone. Also at the same time, seeing so much of hard work which is put in by so many of our stakeholders to make the second chance at life possible. And it is very encouraging to see our transplant recipients who are doing so well. So I think it's a mixed kind of emotion that at least I am feeling today when I'm here in front of you all. And it's a day that celebrates the spirit of service. It's a day that tells us that the power of humanity is above everything else. Medical science in the past decades has seen many advancements, and every day we see some new advancement. It has the power to improve lives, extend lives, change lives. But then the power of humanity, that's the biggest power to make that second chance at life possible. So I'd like to first express my profound gratitude to all the families of the organ donors who are present here today, and so many of them came here on the dais. We are so humbled that we have such people amongst us who decide to inspire the nation with their courage and compassion. We all know what a difficult decision it is. It's a very tough decision. You're losing a family member. That person is going away forever. And at that very, very vulnerable moment, taking a very hard decision to donate the organs, that's really not easy. So I salute each and every family who's present here today and who have decided to take this call and give life to someone else, because the gift of life is the biggest gift that we can give to anyone. I'd also like to congratulate all the doctors, medical professionals, the hospitals, NGOs, volunteers, and different institutions who make tireless efforts to make organ donation and organ transplant possible. And I also acknowledge the good work that has been done by many of our state governments. We really cannot do much without the support of the state machinery. So a lot of state governments have been doing very well. I congratulate them, extend them my greetings. And I do hope that the states will continue to share their best practices and learn from each other. This is a movement that we really need to advance in our country. And I'm proud to say that India has reached a major public health milestone. We've launched our digital pledge portal in the year 2023, and today we are in 2026, in just a span of say about 3 years. The awareness has been increased to an extent that we have today more than 5 lakh Aadhaar verified organ donation pledges, and it's not a mean achievement at all. So many people coming forward and getting associated with this noble journey. And we must always remain thankful to Honorable Prime Minister whose appeals make so much of a difference. Through Man Ki Baat, Prime Minister Narendra Modi ji has appealed to the nation several times, spoken about Angdaan as Mahadan, encouraging people to donate organs. And not just about donation, he's also highlighted the relevance of transporting the organs safely, securely. So Prime Minister's appeal has made a huge difference. It has provided the much needed impetus to this whole drive, and today it has become a public movement. And India is very fortunate to have a Prime Minister who makes everything a public movement, especially when it comes to health. So when we at the Health Ministry, we make a call for creating a TB Mukt Bharat, Prime Minister's appeal makes a huge difference. He has appealed to the nation on several occasions, whether it is about creating a TB Mukt Bharat, or it is about improving maternal and child nutrition, or it is about creating a Swachh Bharat, or organ donation. It makes so much of a difference when he talks about it. And this more than 5 lakh organ donation pledges that we see today and we pride on, that really has been the outcome of the appeals made by, the message that is given by our Honorable Prime Minister. So I thank the Honorable Prime Minister for constantly encouraging the nation and being the guiding light. While we have enhanced the number of organ donation pledges, there's also been a significant progress in the number of transplants we are doing. So, in the year 2013, just before our government took office, the transplants conducted in our country was less than 5,000. But in 2025, it rose to more than 20,000. In a span of 12 years, it's an increase of more than 4 times. And in a single year, this is the highest number of transplants which have taken across the country. India today ranks 3rd globally after US and China in terms of the number of organ transplants we are doing. And the one thing that we emphasize during this event or during any public awareness campaign on organ donation is that we must have more and more of disease donations. And we have made a progress here as well. So more than 3,500 transplants were performed with the organs that were donated from the diseased individuals. This compared to just 837 in the year 2013. However, friends, there still exists a huge gap between the number of patients who are waiting for organ transplants. Secretary Health mentioned that she keeps receiving requests from so many people, and so is the case with the public representatives, with ministers, with MPs, with MLAs. People reach out to us. And we feel that this gap is huge. There are so many people needing an organ transplant, and we have much lesser availability of the organ donors. And that's a challenge we're dealing with as a government, we're dealing with as a society and as a nation. And there are so many hurdles, so many myths, misconceptions which still exist. I say this because there is a part of the country in which we see states which are better performing when it comes to organ donation and transplant, but then there are also states which are not doing much about it. So one of the reasons that we identify is the myths and misconceptions which still prevail, and one of them is also about religion prohibiting organ donation, which is not really the case because every major religion promotes the idea of organ donation as a major act of humanity and nobility. So there's still a long way to go in building that awareness, educating societies, and preparing people psychologically, mentally, preparing families, our societies to take a step forward in giving life to another person. Today we've made many releases, and one of the very important releases has been of several sets of guidelines. The guidelines on brainstem death certification, on swab transplant. These guidelines, I believe, will also further strengthen the policy implementation and standardize the practices across the country, in a way boosting both organ donation as well as transplantation. And one of the key launches today has been of our new campaign, Jug Jug Jiyo Abhiyan. And Jug Jug Jiyo Abhiyan is a year-long nationwide public awareness campaign where we'll take this message to the communities that organ donation is the biggest life-saving act. And when we lose a family member, we lose them forever. But if we do not want to lose them forever, then the best way is to continue their legacy through their organ recipient. And that is the idea, that is the thought which has to be taken to the masses. That if we can even make our lost family member continue to live by donating their organ to someone who's in need. So as we launch Jug Jug Jiyo Abhiyan, I'd like to appeal to each one of you who's present here today. You may be in different roles, but there is so much that we can do collectively. And each one of us can spread the message around and give all our support to Jug Jug Jiyo Abhiyan and make it a success. Today we have built up a huge network. We have 32 organizations. We have a NOTTO which is functioning at the national level. We have 5 ROTOs, the regional organ tissue transplant organizations, and also 26 state level organizations, the SOTOs. And besides that, we have more than 1,200 hospitals, other institutions. So it's a big ecosystem which needs to be strengthened. And there has to be a seamless connection of all these individual units. So to create this seamless network, we've also launched E-Pratyaropan today. E-Pratyaropan is our endeavor to not just create a digital system, but to create a lifeline. And this will make this entire ecosystem very smooth. It will bring not just speed, but also build the hope and trust of millions of families, millions of patients who are waiting for organ transplant across India. Today is also an occasion for me to highlight how, under the National Organ Transplant Program, we are offering financial support for different things that are required in this journey. Whether it is upgrading infrastructure, or it is hiring of the transplant coordinators, maintaining the donors, conducting their dignified funeral of the deceased donors, or transporting the organ, successfully transplanting, and also undertaking the capacity building and training of our healthcare workers. So for each of these, the National Organ Transplant Program offers financial assistance. There are other steps also which Government of India has taken. Under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, and this especially needs to be remembered for our patients who come from the lower income groups. You're all aware that this is one of our flagship initiatives under which we have provided a big financial safety net to 62 crore families who are the bottom 40%, who are the frontline healthcare workers, who are the gig workers, and who are also the elderly citizens. So for anyone who needs a kidney transplant, may he or she not need it anytime, but if at all it is required, then kidney transplant has been included under the health benefit package of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. We have another scheme in our ministry, the Rashtriya Arogya Nidhi, that is primarily aimed at helping, again, patients belonging to the marginalized sections of the society, patients who are economically not so sound. So financial assistance is also provided for organ transplant under Rashtriya Arogya Nidhi. And post-transplant, patients need medicines. We established a network of more than 20,000 Jan Aushadhi stores across the length and breadth of this country, and today more than 2,000 kinds of medicines are being sold at these stores, and which also include affordable post-transplant drugs for patients who need it. This government has worked tremendously on upgrading the medical infrastructure, whether it is fixing up the gaps in our secondary care institutions or building more tertiary healthcare institutions. So we have 23 AIIMS in this country now. And as I am told, around 10 All India Institute of Medical Sciences are today performing transplant surgeries for different organs. Super speciality blocks are being built up in the government medical colleges. We're increasing the super speciality medical seats. And almost in every district of India, we have built new medical colleges which are associated with the district hospitals. So by doing this, we are trying to further strengthen this entire ecosystem. So the access for good healthcare services, especially tertiary healthcare services, increases for all our patients, because eventually the idea that we are working with is attaining universal health coverage for all our citizens. Ladies and gentlemen, while we worry about having more organ donation pledges, having safe retrieval of organs, safely transporting them, successfully transplanting them, and yes, I must mention, I've just been told that the semi-high-speed train, which is India's pride, Vande Bharat, we have transported a donated heart safely through Vande Bharat, and it has been successfully transplanted also. So while we worry about all these things, I have a bigger worry. Why should any country need so many organ transplants? So India today talks of prevention. And our national health policy has taken a complete paradigm shift. While earlier we would talk about curative healthcare, disease elimination, today the new health policy has its focus on prevention and promotion of well-being. So while we continue our efforts at having more organ donation pledges, having more organ donations from the deceased donors, having more successful transplant facilities, we must also intensify our efforts in educating people about preventive healthcare and maintaining healthy lifestyles, so people wouldn't face something like an end-stage organ failure. And this is why our Prime Minister today has become the biggest brand ambassador of yoga. And he appeals to 146 crore Indians, make it a daily wellness practice. It's a zero budget health assurance. We have Fit India movement, which is run by the Ministry of Sports and Youth Affairs. People need to stay healthy. And eating right is so important. We know how sedentary lifestyles and the changes that have come in our dietary habits are contributing to our organs becoming sick. And this awareness has to be built at the right age. The kind of stressful environments we are living in, operating in today, for every individual, irrespective of the area of work, irrespective of the social settings we live in. So what we need to do is eat right. And Ministry of Health and Family Welfare has this entire movement, the Eat Right India movement, which is run by one of our organizations, the FSSAI. It's sad, it's unfortunate, but we have to today educate people about what it means to eat right. Something that we did generations back. Eating what is locally available, eating what is safe, eating what is clean, hygienic, eating what is seasonal, eating what is not so processed, eating what is fresh, and reducing the intake of salt, sugar, and fat in our daily diet. That has become very essential. So we are also working towards this. And just yesterday, Prime Minister launched Nasha Mukt Bharat Abhiyan. We all know what a big challenge it is today. Our society is in the grip of Nasha. And we really need to protect the younger generation. We dream of building a Viksit Bharat by 2047. How do you build a Viksit Bharat? With a generation that is in the grip of drugs and alcohol and tobacco? No. That's unachievable. And Prime Minister has called for, his appeal to the nation once again that, as he always says, we cannot achieve bigger goals for this country with just governments and administrative machineries working. It's a national goal, so the nation has to take a call. We have to, as a nation, as a society, wake up to this cause and protect our younger generation. And especially, I see a lot of youngsters present here today. You're the best voice. You can take this message. You have to protect your own well-being, and you can also encourage your peer groups, other youngsters like you, to stay away from alcohol, drugs, tobacco. So many of these things which are required for keeping India's current and future generation healthy. We have a program, the national program for the prevention and control of the non-communicable diseases, the lifestyle diseases, and under that program, there is a network of more than 185,000 Ayushman Arogya Mandirs. Ayushman Arogya Mandir is the primary healthcare facility, the first point of contact, which is available to any citizen of this country. Today we've provided a package of 12 essential primary healthcare services at these Ayushman Arogya Mandirs. And one of the biggest things that we are doing here, which is, I should say, a major preventive intervention, is the screening of every individual aged 30 and above for diabetes, for hypertension, and for 3 types of common cancer. And we are increasing the ambit of the diseases which are being covered under this program. So the whole point that I'm trying to make is that educating communities about organ donation is important, but educating communities also about keeping fit and healthy, that's equally important. And we need to do this as a nation. Events like the one we are doing today make a huge difference because they remind us that we have this in our history. Whenever and wherever we celebrate, we observe the Indian Organ Donation Day, we're reminded of Maharshi Dadhichi. And we know how he gave away his bones to allow gods to forge Vajra, the weapon to kill the demon. So there is so much in our history to inspire us. And each one of us has that potential to make this contribution. And every person can save up to 8 lives. So many of our vital organs can be donated: our kidneys, lungs, liver, heart, intestines, and also our tissues, skin, bones, cornea. And so many of the donors who came here, they have done it. We can all pledge and we can all take this mission forward. As I said earlier, the gift of life is the greatest gift of all. This is why Angdaan has been called Mahadan. So in conclusion, I just appeal to every citizen, every key stakeholder who's present here today to associate themselves with a new initiative, the Jug Jug Jiyo Abhiyan. Let's make sure every citizen of this country wo Jug Jug Jiye. Thank you very much all. Jai Hind.
I request the Honorable Minister of State to kindly lead us through the organ donation pledge. I request all of you to please stand up at your places and repeat after her.
कृपया अपना दाहिना हाथ आगे करें। संकल्प लेंगे माननीय मुख्य अतिथि महोदया के मार्गदर्शन में।
मैं प्रतिज्ञा करती हूँ कि मैं अपने ऐसे अंगों और ऊतकों को जिनका उपयोग मेरी मृत्यु के पश्चात किसी को नया जीवन देने के लिए किया जा सकता है, उसे दान करूंगी। हमारे देश में प्रत्यारोपण के लिए अंगों और ऊतकों की कमी को देखते हुए मैं यह भी प्रतिज्ञा करती हूं कि मैं अपने परिवार, मित्रों और देशवासियों को भी अपने अंग एवं ऊतक दान करने के लिए प्रेरित करने के लिए सभी प्रयास करूंगी। जय हिंद।